Let me begin with a situation that most therapists may encounter, which is both challenging and concerning. A 29-year-old young man came with a concern. He said, "I get very angry." Now the question is, it is not about the emotion of anger. He continued to say that whenever he gets angry, he seems to get physical as well. He's more worried about the consequences that it might bring about. He had already changed 3 of his jobs because he had conflicts with his superior. And now he's very afraid that if this anger could lead to any legal complications. Now, in this episode, we will try to address this concern. We'll also try to see whether this issue is just the emotion of anger or is it something more deeper. Welcome to Inside the Therapy Room, a channel by Atmanam, Center for Counseling, Psychotherapy and Skills Training. I am Stanny, a practicing psychotherapist with over 20 years of practice. And in this channel, we will be discussing cases that I have attended, of course, changing the details for confidentiality's sake. In this channel, we will be exploring cases, how to understand the case, how we can interpret the theoretical overviews, and then how we can integrate therapeutic interventions. This channel is for serious learners and for young therapists. Welcome, we will dive into this case. Let us understand the client more in detail. Let us call him Vicky, a 29-year-old working professional. His main concern was anger that turns into aggression. And as he stated before, that his anger can escalate into aggressive behavior. At various instances, Vicky stated that he felt disrespected by authority figures. He also felt that the situations were unjust and he felt not in control. Vicky felt that this issue can escalate to a point where he might have certain legal consequences. He also stated an incident. One day when he was traveling in his car on a highway, he wanted to overtake a truck that was traveling right in front of him. He asked for a pass sign and the driver of the truck said to pass. And while he was trying to overtake the truck driver tried to push him down the median. Vicky got angry. He stopped the car right in front of the truck, pulled the driver and beat him up. And after this action, he felt scared. The issue here is Vicky is aware of the situation. It is a good thing because the client has to cooperate in the process of therapy. The client cannot be a passive participant in this process. At this stage, we will try to understand key patterns. From Vicky's story, we saw that there are 4 main concerns that disturbs him. Number 1, there is an issue of violation of boundaries. Number 2, there is perceived injustice. 3, there is a thought that goes on in Vicky's mind where he feels that people are not sincere. And fourthly, there is emotional injury. These 4 dimensions are clinically significant in understanding anger. Now, we begin to form hypotheses. From a cognitive perspective of rational emotive behavior therapy, are there any rigid belief systems that actually makes Vicky act in this particular fashion? From a diagnostic perspective, especially the DSM and the ICD, we may consider whether there are patterns of impulsive behavior or anger dysregulation. From a personality perspective, we need to explore whether this is frustration tolerance or impulsive reaction. We need to understand that we cannot draw a conclusion as of now. We need to test our hypotheses, and then we will be able to pinpoint what our actual issue is. Let us explore further. As therapy progressed, an important information came about from Vicky regarding his family. Vicky's father was a policeman who used to be very harsh and strict with him. Vicky mentioned that he used to be beaten by his father until age 16. And when he was 16, when his father tried to punish him, he held the belt and raised his hand against his father. And from that time onwards, his father had stopped beating him. Probably this could give us an insight that Vicky learned that aggression, if met with aggression, can make him feel powerful. Vicky had harbored a lot of sadness, fear, and shame when it came to his father. When there is a repeated exposure of fear and control in childhood, people can take up reactive behaviors or defensive patterns. Anger is not a product of the current situation, but it is an extension of the past. From this, we understand that anger is not very simple, but it is much deeper. Anger is linked with unresolved situations of the past, especially the hurt that Vicky endured, and his learned aggressive defensive patterns. In simple terms, Vicky experienced disrespect, injustice, and a threat. And he felt vulnerable and helpless, and his response to this is aggression. His systems reacts automatically to overcome the situation whenever he senses threat. Now comes the intervention phase. We had used a combination of methods in treating Vicky. Firstly, we used Gestalt empty chair technique, wherein we provided a safe space for Vicky to vent out his anger, especially towards his father, and he was encouraged to express his hurt feelings, his anger, his frustration, and his resistance. Many times, people like Vicky do not have an opportunity to understand and express their emotion in a safe environment. So here in Gestalt therapy, we help them and provide them a safe space. This process brings self-awareness in Vicky, and it also helps him to release his anger that he has been holding for a long, long time. The second therapy that we used was rational emotive behavior therapy. In this, we used Socratic questioning to Vicky, and we asked him certain straightforward questions. We asked him, can people be the way that they want, despite of what Vicky wanted? This sort of gave him the insight that people can be the way that they wanted, and also we also examined, is it ideal or realistic? Can unfair situation exist without aggression? And what are the consequences of holding on to this rigid belief system? Gradually, we helped Vicky move towards flexible thinking and increase in frustration tolerance. Thirdly, we helped Vicky to be aware of the early signs of anger, bodily sensations, and the thought process. This builds a self-awareness before escalation. And fourthly, we introduced behavior regulations. We introduced pausing before reacting, stepping away from the trigger stimulus, and becoming aware of what's going on within. This probably gives him the heightened awareness before he could act. This is crucial because insights alone does not create change, but the awareness of what's going on here and now is the key to optimal change. Over time, Vicky felt very comfortable with himself. He recognized the triggers and he delayed his reaction time. This gave him more control and awareness. Most importantly, he found that his physical aggression has reduced phenomenally. This case highlights anger often seems like a simple emotion. Underneath anger, there may be injury, fear, humiliation, and helplessness. Early experiences can shape the way that we respond to situations, especially anger and conflict. Such cases present real challenges: risk of harming others, managing client resistance, balancing empathy with accountability. Also, the therapist has to be aware that we are not there to judge the client, but we are there to journey with the client with empathy. At the same time, we are firm to point out the deficit of the client. Let me leave you with a few questions for reflection. When does anger becomes a defense mechanism and not an emotion? How do we differentiate between maladaptive anger and justified anger? And if you were to be the therapist of this case, how would you go about in treating Vicky? Tell me about it in the comments, and kindly share, subscribe, and also comment. We'll be happy to listen to you. Until next Wednesday, we wish you all the best for better learning. Thank you.